I mean, just thinking about things like morphine, opioids, like it seems like we do accept a certain level of risk with medications and
Yeah.
with especially medications like that. Is there like, do we know about the effect of cannabis in a non-medical setting, like in someone who's not got a specific condition? So in the same way we know like alcohol causes vernix encephalopathy or steroids cause Cushing's or something. Do you know what I mean?
Yeah. No, I do. So, so I guess we've talked a little bit about like psychosis beforehand. So like people who are predispositioned, like can get cannabis-induced psychosis from like heavy cannabis use. The other one is you can get like a cyclical vomiting syndrome. So the typical symptoms of that are kind of, as it says, like heavy amounts of vomiting.
Yeah.
And interestingly, the thing that calms it is typically people report taking hot showers or hot baths, and that tends to relieve it. And that's actually working via the TRPV1 receptors, causing like that heat sensation on your abdomen, and then that relieves like the vomiting. But the only way that those people can really stop that is via abstinence from cannabis. There's like that's the treatment for that essentially. Again, interestingly, in terms of patients that we've seen at Curaleaf Clinic, we have had one confirmed case, and a couple of maybes. It was that, maybe it wasn't. But we've been cautious and said we shouldn't continue. But we don't tend to see it as much in these medical populations, whatever the reason may be, whether it's the way in which we're prescribing, the way in which we oversee them, the kind of what they're being prescribed compared to what they're, what someone would take illicitly or in a recreational setting. But yeah, again, in medical settings, we just don't tend to see it as much.
Yeah.